Meaningful Use Stage 2, Menu Set 2, Electronic Patient Notes. The requirements for Menu Set 2 is to enter at least one electronic progress note that is created, edited, and signed by an eligible provider for more than 30% of the unique patients who have at least one office visit during the reporting period. The text of the note must be searchable, and it may contain drawings and other content. The objective is to ensure that physicians within their certified electronic health record technology are in fact keeping electronic notes as part of their patient record. Now, at the end of the reporting period for attestation, this will be a numerical result reported, meaning a denominator and a numerator. The denominator will represent all of the unique patients seen by the doctor within the reporting and up until the attestation date, who have at least one office visit within the 90-day period. The numerator, out of those unique patients with office visits, must have at least one electronic note generated, and it must exceed 30%. Now, just a couple of notes with regards to Menu Set 2. As mentioned in the measure itself, the electronic note must be text searchable. It may contain drawings and images as well. Now, the data can be dictated or it can be entered via the EMR structured data as long as it is searchable. So for those of you who use Dragon, that is fine. That is still going to be compliant with this measure. My Notes is automatically generated and stored when you close an encounter. So to be quite honest with you, if you close all of your encounters, you're going to be at 100% for Menu Set 2. If you don't close your encounters, which is not recommended, but it is your choice, you can generate My Notes ad hoc for an open encounter so that you could still be compliant. The default progress note does not count in the numerator, however, on open encounters, because the default progress note is just always there. It's something that the system is creating in real time, and the criteria in the measure is that the electronic note stored is signed by an eligible provider. As long as the encounter is open, the physician has not applied his or her signature. There are no exclusions available for this Menu Set measure. Now we're going to toggle into prognosis, where I have opened Donna Paulson's chart. I'm logged in as Dr. Cooper. You can see that there is some documentation already, and I'm just going to go here on the left-hand side to progress note. Now again, since our encounter band at the top is blue, that means it is an open encounter. So currently, Donna, even though she is an office visit within my reporting period and therefore is in the denominator, while the encounter is open, she is not being counted in my numerator. Notice as we look at our progress note tabs, we are on the default tab. But if I go to My Notes, it is empty. So if you want to keep encounters open but still get credit, the way you do that is selecting the My Notes tab, which gives you this pick list choice over here. And you can have up to 6 different quote-unquote My Notes that could be considered your signed electronic note while the encounter is left open. So we'll just go ahead and choose My Notes. We have a little notepad icon that allows us to stipulate, do we want to start off blank? Do we want to start with our default progress note? Maybe we want a copy of the system-generated default, but we just want to make some changes before we close it. Maybe we want to bring in another template, or just straight out copy the last visit's progress note and modify it. Now the default value, as you see, is to start with a copy of the default progress note. So we're going to go ahead and click OK. Now we do have a My Notes started. So even if we leave our encounter open, the system will give you credit in the numerator once you save the My Note. Now you'll remember that some of the other criteria was that these notes be editable. You saw me, I just now made a note on it and saved it. It must also be searchable. As we are in our view, if you look up here on our icon bar, we do have a magnifying glass that allows us to do a find and replace. Find and replace is only available under My Notes because My Notes opens in data entry mode. So that is where you also get the criteria of being able to modify it. I'm going to go ahead and delete this my note because I want to close the encounter so you can see the other way. So now that we no longer have a my note, the default is all we have, so we're back to her not being in the numerator. I'm just going to go ahead and close my encounter now. So now my patient band has turned charcoal gray, which of course indicates that it's closed, and my notes is all that I have on the chart. Notice how the default is grayed out. So at this point, Donna is now counted in the numerator.